much. Hello, Salil. That's amazing. Oh, God. Sure. Good evening, everybody. My name is Harshita Umesh, and I will be moderating from the side of IMA MSN Karnataka. And my co-moderator is Mahi Hiran Shah, who has internet issues at her hostel. So all hostelites, please tell me you relate, Max. No? Okay, then. I'm just making jokes to myself. Okay, so before we start, I hope you've all read the safe space guidelines. If you have, can you please send in a thumbs up in the chat box? Have you guys not read the safe space guidelines? Okay, I see two hands, three. That's great. So a lot of you have read it. For those of you who haven't, we'll just quickly go through it. Basically, please don't make any assumptions. Vegas rule: what happens here stays here. Don't be oppressive. Please don't get into conflicts. Use accessible language. Give content or trigger warnings when you're going to speak. Privacy and confidentiality should be maintained at all times, and zero tolerance policy for any sort of harassment. With that, we have Mahi back. So, Mahi, would you like to continue with the introductions?
Yes, yes. So, have we started the stream?
Yes, we have.
Okay. So, good evening, everyone. I am Mahisha from IMA MSN Maharashtra, and I extend my warm welcome to all the participants and also IMA MSN Karnataka for this event. So, this event is a collaboration between MSN Maharashtra and Karnataka. I will be the moderator from the Maharashtra side, and Harshita will be the moderator from Karnataka side. So we have a very interesting group discussion, Utopia, about ways for promoting inclusivity in medical education and healthcare. So I think we'll start one by one. Each participant gets a chance to present their own point of view on the panel topics which were posted on the group, and then other participants can also counter question or add their valuable feedback to the same. So I think Harshita will take on from you.
Sure. Just a request to participants, since we are on live stream, I would like to pin your videos. So if you'd like to start, we can have you raise your hand and we can go ahead. The floor is now open. Do you want me to prompt?
Everybody has to one by one. So I think Ananya, you can start maybe.
Yeah. Is that referring to me? Yeah.
Please
Um,
introduce yourself with your preferred pronouns.
yeah, I'm Ananya and my pronouns are she and her. So with regards to changes in the medical curriculum, I think we can have start including comprehensive sexual education, CSE, the syllabus for CSE for all medical students. Since we've started, I'm part of the CBME batch, the first CBME batch. So they haven't had any sensitization for gender or sexuality. Uh, I've never heard of any seniors also having such sessions in other colleges as well. So we can start by including CSE and sexuality sensitization, gender sensitization in all medical colleges. Um,
Yeah, so adding to
transgender,
that, I think,
yeah.
yeah, so regarding CBME curriculum, I think NMC has issued a guideline for all the medical colleges and universities in regards to the organization of IIM Madras in a written version, which was to meant to end any non-scientific forensic text have uninformed or marks, which which not kind to the people who I think able to the forensic and state book.
Mahi, I don't think your voice was too audible. But does anybody else want to add on to what Ananya has stated over here about comprehensive sex education? She does make a very valid point. Thank you, Ananya, for bringing it up. That a lot of people don't know the difference between gender and sexuality. Does everybody here know the difference? If no, but if there's anybody who doesn't, please put. You can DM me separately, and we can get into a discussion about that. But it is very important that we do understand that sexuality and gender are two different things. Would anybody like to add on to her comprehensive sex education point and the changes they would like to bring about in the medical curriculum?
You could
Hi,
also write in the chat box.
Yeah.
am I audible?
Yes, you are.
So, my name is Shreyas, my preferred pronouns being he, him. Regarding the changes which can be implemented in the medical education regarding this field, I am part of the CBME batch. So, seeing a few modules on with AdCom, ethics, and all that, will sort of help sensitize the students not only in first year but across the platform regarding their how to deal with, how to treat, and how you're supposed to interact with people from the community. So that as and when they approach their career, as and when they become doctors, start practicing, it isn't an awkward situation. So maybe having discussions like we're having now, having quizzes, having talks, having people come in from the community to talk to the students, help them identify what their sexuality is, irrespective of their gender, might be fruitful.
Oh, that is very true. Representation is extremely important. And if there is anybody from the community over here, I would just like to say this is amazing thing for us to actually learn more about you, to be able to advocate better for you people. But at the same time, we completely understand that as heterosexual cis people, that perhaps we don't completely understand everything that the community is going through. So I think, Shreyas, you do bring up a very valid point when you say AdCom modules could actually help us advocate better for a community and help doctors be more inclusive in the healthcare. Does anybody else have anything to say about the changes they'd like in the medical curriculum? Or shall we move on to the next topic?
I just have wanted to add one more point. I am Rakshita and my preferred pronouns are she and her. Um yes, even I'm from the CBME batch, and yeah, during our 8Com sessions, we have an open discussion regarding how to deal with a particular situation, maybe based on if there's any negligence or any certain topics like that. Just like that, we could include more situations and scenarios where there's an open discussion from the students and the teachers. Here we are dealing with teachers who have been in the field for multiple years and may have some fixed notions about certain things. So when we as the new generation can add and improve their knowledge and also learn their perspectives, we can both grow as people. So 8Com, 8Com, and also in certain subjects like physiology, anatomy, OBGY, and even psychiatry, there are, especially forensic medicine, we have big changes to do. And identifying and actually going and telling it to the authorities that this is wrong is more important. We need to bring it to their notice. And also, recently NMC guidelines came out regarding forensic medicine and usage of discriminatory terms and also discriminatory education. But I'm not seeing any change as far as it is concerned in my college, at least. It has not happened yet. There has been no reinforcement regarding the same. and that's important. Just making policies won't help. We need to reinforce it. We have to check if it's actually happening. So yeah, that's all I have to say. Thank you.
That is such a beautiful way of describing it. I want to really applaud the way you've put your points forward. With that being said, I completely agree. We are very under equipped to deal with any conflicts or any situations that may arise. And yes, there is a lot of changes to be implemented in our subjects and textbooks. But at the same time, I would also like to bring to notice Section 377. Does everyone know what that section is? Okay, thank God. Love you guys. So, change is happening. It's not like change isn't
Yes.
happening, but we are trying to change decades old mindsets, right? It's not something that just happened overnight. Oppression, discrimination is not something that happens overnight. And what we need to understand about oppression and depression is it comes subconsciously. It's not that we intend to do it. Suddenly, you might see anybody kissing, or you might see somebody from the community, and you might be like, oh my God, I've heard all of these different kind of stories about them. Is it okay for me to trust them? Is it okay for me to talk to them about this? Right? I mean, we say that we are woke and we are the young generation and we're comfortable talking about all of this. But are we actually really that comfortable as we think we are? I think that's one of the questions that we should be asking ourselves. Having friends from the community, what has helped is starting with a disclaimer saying, I am she, her, and I identify as heterosexual cis female. And I understand that I come from a privileged place where I'm allowed to express my sexuality, albeit a little not as freely as we'd like to, because this is India and everything's conservative. But still, we do get to discuss our sexuality at least. So, and asking them, what do you
Mm.
think is the right way? How can I help you out? I feel like starting that conversation itself with people in the community and knowing how to approach them would actually bring about big waves of change. So, does if nobody else has anything to add to changes in the medical curriculum, shall we move on to the next topic? Um,
I think I have to say something. Am I audible?
sure, sure. Give me a minute.
Yeah.
Please go ahead.
Hello?
The floor is yours.
Yeah. Yeah, Harshita, you sounded absolutely correct on that part that we actually need to bring the change. So I think regarding medical curriculum, we could start off from as basic as the first year subject. So I'm also a part of CBME curriculum. So we could start off from the basic subject, which is anatomy. So we all learn female and males anatomy, but I don't think we have transgenders and anatomy. So I could not only just focus on EdCom, and we could also include, we could also be more inclusive and add more subjects, which is anatomy, physiology, and biochemistry to the whole transgender and LGBTQ community. That's what I have to add.
Definitely. All right, shall we go into homophobia in health centers? Somebody who's not had the
Harshita?
stage yet. Yes,
Yeah, I'm audible.
yes,
Yeah, I also would like to add something.
sure.
It's not just about the curriculum that we're talking about. All the people who are concerned with the healthcare sector should be educated about these things. So,
Definitely.
workshops and different sessions must be
Yeah.
organized for this.
Yes.
Yeah,
So,
that's
do
all.
you feel that there's a lot of discrimination in the healthcare setup, like this homophobia in healthcare centers?
Sorry, can you repeat?
Do you feel like there's a lot of discrimination in the healthcare center against the community, such as homophobia in healthcare centers?
Of course, there is.
So, how would you look at it?
According to me, like we don't realize it when we do it. So sessions like this, when we conduct sessions like this, then only it will come to your consciousness. Okay, these things are happening. We must do something about it.
Mhm. Does anybody else want to add on any points?
I
Okay, Ananya, go ahead, go ahead.
Um,
Anya, what do you think?
Yeah, sorry, I was just waiting for someone else to speak. So, Yeah. So regarding homophobia and transphobia also in the healthcare community, there was an incident last year as well, where a 28-year-old trans woman in Kerala, she wasn't given proper care. Her name was Ananya Kumari Alex. So she was denied proper care, and the surgery was not done properly by the doctors, and the hormone replacement, none of that was done properly, and she had uh, issues, and then she died, and that was because the care wasn't given properly, and the doctors themselves weren't sensitized on how to deal with a trans patient. And even though they're medical professionals, they're not educated on how to deal with a queer person or a trans person, or how to talk to them in a way that doesn't alienate them. And I've seen so much homophobia and transphobia even in our colleges. There's like someone who says something every other day, and I have to just like keep my mouth shut and not say anything, because you can't go arguing with everyone and telling them what to do. And it's not very easy to open up people's minds, and not everyone's willing to have a discussion about it. Uh, People using the word like gay as an insult still in 2022. So I hear classmates doing that every single day, and not just at the like student level, but in the healthcare community, our professors who are definitely, I've heard homophobic comments from them as well, and gynecologists. Who haven't been sensitized, nurses, anyone in the medical community, staff, healthcare professionals, caregivers at different levels. I think having sensitization at all those levels will help trans people and queer people seek medical care better, and gender affirmative care. So, yeah.
I have no words to say. It's very profound.
That's a
Whatever you
very
said, I'm speechless at the moment.
I wanted to add something to this. So, as we were speaking about transphobia and homophobia, biphobia, all the phobias in the world, but for now, there's always a divide. It's a we versus they. They, the homosexuals, they, the bisexuals, they, the transgender people. Once we realize that we are all human, and like that is like the basic knowledge that everyone should have, even in healthcare setups. For example, maybe a HIV positive patient, or like certain diseases which are more prevalent among the queer community, but also present in the straight community as well. We should not categorize people or judge them based on their sexual activities or promiscuity, as they call it. But what I would like to improve is actually speaking about it, not being shush about it, not making it a taboo. There's so much go on under the covers where they're just like there's a they and a we, as I said, and like they don't want to talk about the days, which is weird.
All
Uh,
right.
that's
So
all.
let me cut you short here to
Yeah.
explain this disparity that's happening. It's not exactly a they we situation as we perceive it to be. It's more of how a power play or power dynamics comes into picture. When you have a majority and a minority, it is very how do I put it? It is very evident that there are biases that automatically come in because they say, hey, this is the norm, this is normal, because majority people are doing this and you guys are not. So if you're standing out from the crowd, and this is not just with respect to the community, I'm saying this with respect to most things, it happens that when you are part of any minority group, so many times your rights are violated without you being realizing it. Just like how I believe Ananya mentioned that people are still using gay as an insult in 2022. And that's not a right thing to do. But how do we actually, like I said, discussions need to be started. Discussions, it should not be a shushed topic anymore, and sensitization should be done to people who are working in the healthcare setup. But even if there was a 50-50 balance, there will still be power dynamics where you still have one person who will be higher and one person who will be lower. Equal opportunities is something, equity is something that we hope to happen, but it's something that is very hard to come by. And when Ananya was speaking about how there is a lot of discrimination in the healthcare setup, I would like to mention how I had talked to one of the friends that I have in the community. And the discrimination doesn't start inside, where we are focusing completely on the doctors itself. But just imagine if you are stopped by the security guard itself saying, "Hey, but you don't look like a woman. How can you go inside to the gynecologist? This is a woman's only territory." And how would that person explain that, no, I need to do this because of so and so reasons? And everybody over there, all the patients staring at you, and talking and whispering. Us itself as human beings, when we walk into a classroom or we walk into any place with all eyes on us, we feel so scrutinized and we feel so vulnerable, don't we? So when these people and walk in and people are looking at them and they're talking, it just makes it that much more worse. And then the final step, let's just say we assume that they still say that even after all this discrimination, they reach the doctor, and then something like this happens. We're looking at the very end step where they're reaching the doctor and we're saying that the doctor is not sensitized. But what about all these hurdles that they have to pass through to actually seek treatment? I think that is something that we need to really look into, because if they're not going to cross these hurdles, they might not even reach us. I completely agree with the point that if they do reach us and we're not affirmative and we are very conservative or we do pass comments, it is extremely devastating and extremely harmful. But at the same time, we need to realize that the access for their healthcare is barred at a much primitive level than we're assuming it to be. Would anybody else like to add on any points before we go to the next topic?
Harshita, I agree with the statements. Maybe one step or one measure you can take to reduce that scrutiny which the person might face as they step in might be to incentivize or maybe promote or have certain benefits to get people from the community to volunteer or to start working in the healthcare system. Like if there is a nurse or there's a ward boy who is from the community, then the person might not have so much awkwardness stepping in and talking about it. Maybe that will help people feel more comfortable, so that let's forget the end stage right now and concentrate on just getting them in. If
Yes,
you're able to get them in, then we can think about what is going to happen at the doctor's end.
definitely. With that being said, I would
Yes,
like to
I
mention.
think
Oh, please, Mahi.
uh, yes. Shreyas has rightly said that. So I think what we could do is make institutions community friendly, and we could also demonstrate that by taking time and making posters or portraying our own healthcare institution as LGBTQ friendly, so that so that people in the community will and
I believe Mahi has network issues. So what she was trying to say is to make our hospitals more LGBTQ friendly. And with that being said, I think it is really important that we do that. But I would also like to bring to your notice the fact that we do have medical personnel who are in the community, who do identify with various sexualities and may not identify as cis. They would be on the spectrum, but and they themselves are scared of actually coming out or saying something. So I think there's a lot that we need to discuss, and without adequate representation of somebody in the community here, I believe it would be difficult for us to gauge the scope of the situation. So, shall we move on to the next topic then? And those who haven't spoken yet, could I please request you guys to speak up, or do you want me to call names? Please don't make me call names. Okay. Who should I call? Sanika?
Hello, Harshita. I'm Sanika.
Hi.
I My pronouns are she and her.
Hello.
So I would like to add few points like you all discussed right now. So there are many people who are in the queer community and are in the medical field, but they are facing the same problem. Like patients, they refuse to go to them. So I know few of the doctors, like Trinetra. So, she addressed few issues like people don't really choose to, counsel them. Like there are discriminations happening. So I think the major issue here is lack of knowledge. So, you can't really blame the people because in India it is a taboo, even like speaking about it. So education is lacking somewhere, and I think not only in medical career, the queer community education should be introduced in our preschool. That will help in future, obviously.
So, definitely there is a lack of education awareness, but would you say that with Pride Month and all of the activism that's going on now, that it has increased the visibility and the awareness?
Yeah, obviously, like it is increasing. Like recently we had a session with IMA. So the in that session, Prince, like a royal family, the yeah, right, so he shared his experience of coming out, and I think the more we are getting exposed to it, the more we learn and more, we seek knowledge. So it's like spreading awareness is the most important thing right now.
Yeah, I'm so sorry about that
Yeah, it's fine.
family thing.
Yeah.
Yeah. So yes, I'm really glad that you did bring that up. Representation is extremely important, and I think IMA MSN Maharashtra did a beautiful job when they had
Yeah.
a speaker who came up very recently to speak about the community.
Yeah.
Yeah, Ananya Bhasi, a great friend, and she's been amazing in helping me also learn more about the community. Well, what you also said, and please correct me if I'm wrong, that you would like to start educating people about gender and sexuality in
Yeah.
preschool, is it?
Like not in preschool, like in high school, at least some basic knowledge. And you should tell them that talking about it isn't wrong, like it is completely natural, because even like parents don't talk about it so openly. So
Hmm.
basic education must be provided.
So, in a place like India where talking about sex itself is taboo,
Yeah.
how do you think it would feel for how do you think the conversation could start in
Yeah,
schools?
like it's very difficult to open up actually, but at the least thing you can do is not talk bad about it. Or if a child is asking few questions, you shouldn't tell that child that this is wrong and this is right. Instead you can like give some positive response, so he won't like feel like it's a taboo or something like that.
Yeah, that definitely is one way to go. Yes, Shreyas, I can see you.
Uh, you were talking about how the conversation might begin, considering that India has a taboo regarding sex education itself. So maybe instead of having group discussions like in a class or in a college or in a society, have a one-on-one session so that there's no peer influences, there's no performance pressure, or there's no external forces like parents or friends or relatives who are influencing what you say, because the person might not be comfortable coming out in front of his parents, but with the counselor or with someone from the community, he or she might open up. So maybe holding and conducting one-on-one sessions, small groups at a time, maybe 15 people, taking them one-on-one, then like spreading it in a college for 3 4 days might help.
Honestly, as somebody who's not in the community, I don't know how to respond, but these do seem like very valuable suggestions, and I will cross check
Hi,
them.
Harshita. Am I audible?
Yes, you are. Let me just pin you. Can you turn on your camera, please?
Yes. Hi, everybody. My name is Alankrita, and my pronouns are she, her. So, I would just like to add on to what Shreyas has said here. When we talk about lack of education in medical colleges, I think first we should start by educating our professors, because I know that our generation is so much more accepting to the community, but there is so much homophobia when it comes to professors or when it comes to hospital accepting and treating these patients. And so I think first it should start in every college at the root cause, that is the generation that's right above us, so that later, so that the people who are going for treatments now, they are given a fair chance and they don't undergo any mental pressure. Because I'm sure that although homophobia exists in our generation, it's not much as compared to our parents or our professors. So I think that's where we should start.
So, with that, I'll just explain why we use the down to top approach rather than the top to down approach. When you're talking about decades of oppression and discrimination, it is really difficult to actually change somebody's mind overnight. But as Mahi has mentioned on the chat box, we see youth coming out today at an increasingly high rate and being vocal and how they can't get the required help. We relate better with people our age, right? I mean, we ask our classmates to teach us stuff like before the exam, like, please, bro, 5 minutes, just tell me whatever you know, I want to pass. We can't go and say the same thing to a professor, and the way our classmates would explain it to us would be much more different than the way a professor would explain something to us, right? So that is why we educate people in and around us. And yes, has anyone tried educating their parents over here? Show of hands, please.
Very unsuccessful attempts, but yes.
Yeah.
I have tried with moderately successful attempts, like maybe on the higher side, but not completely so.
So, my best friend is trans and they identify as they, them. And I'm still getting used to using the right pronouns, something that's taking a conscious effort on my part. And for something I've apologized numerous times. But when I spoke to my parents about it, initially it was difficult for them to accept, for them to actually understand what it is. They aren't very aware of the terminologies and what it means. And there's a lot of things that youth are into these days, right? Things aren't really great. So people make the assumption that, hey, this might just be a passing phase, which is a really horrible assumption to make because it mostly isn't when you're feeling such kind of discomfort within you about your own identity. But it is something that parents actually say to people. Hey, this is just a passing phase. Maybe you getting into this in peer pressure. Maybe you're trying to act cool. You don't actually feel like that. But it wasn't in our scriptures. We never had these problems. Trigger warning right now for all these comments, but this is stuff that people have been told. We're gonna disown you or something like that, which is why people, when they open up to people that they're closer to. They open up slowly, and even then it's always in parts. I don't think anybody comes out altogether. And with that being said, it's even the same thing for us, right? Like when we make a new friend, we tell them slowly parts and parts about us until we become closer to them. So acceptance comes more easily at a lower level because they're not influenced by everything else that's happened. So that is why educating our professors, while it's an amazing idea and it should be inculcated, we don't take that approach because obviously there's a barrier between us and them when speaking, and we have to always be respectful and all of that. And sometimes when talking about such sensitive topics, it can be difficult. But let's say our professors are much more knowledgeable about puberty blockers and hormonal therapy that can actually be given to these people. So, what are your thoughts on that?
I think it is, as you said, it is very difficult to educate them, and it's not going to happen overnight. We need to have multiple sessions, but
it just depends on the type of people we are dealing with. If they're willing to understand the topic, if they're willing to put in an effort to understand the types of people, only then we can do something about it, because they have experienced this whole stigma and they've been through a huge part of their life with the same mindset. So I think it's just about the effort people are willing to put in to solve this problem. Although they're very knowledgeable on certain medical topics, but when it comes to understanding it emotionally and empathetically, I think it just depends on how much they are willing to.
So, say that you receive some person who would like to be on puberty blockers or hormonal therapy, and you refer them to a professor who is inclusive and considerate to the community. How do you think this would pan out? What do you think would be the issues?
If the professor is inclusive to the community, then I think there shouldn't be any issue, because since they are open about it and they're willing to accept these patients. But if I do refer to somebody who is not at all comfortable with it, I don't think they will deny the right, because again, it's the right of the patient. They can demand whatever they want to, and the doctors don't have the authority to decline anything. But I think it will just be referred and will be judged a lot in the society.
Does anybody else want to say anything about this topic? Puberty blockers and hormonal therapy?
Harshita, like you said, as to what would happen when a patient comes up to a doctor or when he is referred. The issue is not when the doctor is already sensitized, because then he already knows how to deal with the patient. The issues will come up when the doctor is not inclusive. Then they might not know the correct way to prescribe or to go ahead with therapy, talk about long term planning, follow ups, and all that, all the future planning. So maybe that will result into wrong treatment or a negative impact on the patient, maybe resulting into the patient not coming for future sessions and then taking self medication from Google Baba. So, and that self medication is not necessarily going to be correct because it's just there. Someone has just put it up. So I believe that, like Alankrita said, it's not a one-day process. It's going to take years or maybe months to sensitize all the doctors who are already there and the new coming doctors, so that in the future they're able to talk to the patients and prescribe, deal with, and go through the therapy with the patient comfortably without making it an awkward or a stigmatized kind of incident.
Definitely with um friends in the community, again, from what I've heard, they have brought up the same things that you have mentioned in your points. So I think that's like very well informed and thought out of. But there are issues that we would also face as medical students. Supposing, let's just look at this in a purely biological and medical term and remove the community out of it. What would happen if you actually put someone on hormonal therapy? What would happen if you actually put someone on puberty blockers? There's a lot of physiological changes, there's a lot of endocrinological changes, and there are also a lot of structural changes that happen at that particular time that you are arresting. If something like this does happen, okay, for whatever reasons, and obviously with their consent, are you confident enough that you are equipped with actually dealing with it, the after effects of it? For example, let's take something very simple. Everyone's heard of contraceptives here, right? And a lot of people use contraceptive pills, which are essentially estrogen and progesterone mixed pills, right? So, people have read pharmacology. You guys know that it comes with a risk of increase in thromboembolism, so on and so forth. So, if we aren't educated about the community, this was something I was talking to my best friend about. I was like, if someone comes to me and they say they want to be on puberty blockers or hormonal therapy, I am terrified. Not that I won't be able to give them the treatment, but after the treatment, the following up aspect of it. I don't know what the bad outcomes could be because there's so much less documented data and research. And I'm not talking about them as guinea pigs, but I'm saying in general. When it comes to putting anybody on any sort of treatment for that particular matter, in any particular instance, even if it's for preventive use or curative use, and we're not educated about it. And if something, God forbid, goes wrong, are we equipped as healthcare professionals to deal with it? And if we aren't, then where exactly is the issue? It's not like we aren't aware what these drugs can do. It's not like we aren't aware of um, how to follow up. But if we do prescribe them, and later on they aren't able to follow up with us because, like we mentioned, right, there's so much of discrimination in actually coming up to the doctor itself, it could result in a lot of complications that we haven't seen, right? And there also comes to the fact that we have certain guidelines, forensic medicine, for those of you, that up till a certain age, a child is not allowed to take their own medical directive. It has to be under parental consent. Now, for somebody who's going through the changes and who might be in the community, can you imagine how difficult it might be at that particular moment? First, you have to come out to your parents, and then you have to convince them that you need to be on puberty blockers or hormonal therapy. When you're not even comfortable actually to tell your parents that, hey, I am a part of the community, and I want to be respected for the same thing, right? It is at points like this where your wish is no longer your own. It's ultimately what somebody else decides. And um, I want to ask you guys, do you feel like this would be a breach of their consent? Anybody can answer. Should I call names? Vaibhav? Ashwath? I'm just calling names. Okay, does anyone want to talk about this? What your views are?
Yeah, so I didn't really understand your question. A breach of the consent being the minor who,
Yeah.
yeah, so I think uh, autonomy for minors and making decisions regarding their bodies, we don't know that's not possible. I don't think in our country with like the kind of family structures that we have, that's difficult. And if we are referred as healthcare professionals, we have a patient who comes to us who might be questioning their gender and who might be interested in starting hormonal therapy. Having discussions with their parents, not just alone, but also with mental health care professionals who will help counsel the parents into understanding what can happen, along with us having a joint session where you are counseling the parents and educating them about it, and you're having a discussion along with the patient themselves, who's talking to you about what their needs are and how the treatment might help them. And not just that, but regarding the after effects you mentioned, um, apart from the physical after effects, like thromboembolism and stroke risk and cardiovascular risks and all, apart from that, mental health factors also come into play. So when you're on hormonal therapy and you're having as a side effect, you're having depression, or not just as a side effect of the hormones, but also as a part of the discrimination you face, you're having depression or other mental health issues, having counseling sessions for the patients as well, along with that, making sure that mental health care is more accessible to patients who need that when they're on therapy, and making sure that you're not questioning their own decision to start hormonal therapy when they have made an informed decision about it, and not making the decision for them is very important.
I think I concur with all the points that you've mentioned, but again, I will have to confirm everything that is being said on this particular open discussion with people in the community, because I'm not a part of the community, and I think they would be better equipped to actually confirm if what we are saying would actually be that useful or helpful to them. But it is very true that you spoke about mental harassment that they might go through because of everything that's happening in their life. And I just have one question with respect to that. Do you think our anti ragging committees are equipped to deal with it?
As
I
of the
don't.
current situation, I wouldn't trust my college's anti-ragging committee to be strongly equipped with the people or with the knowledge and foresight to deal with and respond to or help people from the community who are being ragged, who are depressed, who have mental issues, who want to talk about something, who are frustrated, who have pressure, or whatever it is. So, but I believe that maybe us, even if we take the initiative, there's what 20 of us in this discussion right now, 20 different colleges maybe. If there's 20 different colleges starting one step at a time, being part of the anti-ragging committee, helping, making it a safer place for people to come out. Because coming out itself is a very important step for somebody in the community and a very crucial one at that. And I feel it should not be seen with hate, negativity, or should not be opposed and be a cause of shame. The person should not be ostracized. So I believe us taking that little step and trying to make it a more wholesome and inclusive environment in the anti-ragging committee over the years might help. But as of now, I have a big question mark.
I see a lot of people saying that they don't trust their college ragging committees. I'm a little concerned. But yes, Ananya, the floor is yours.
I wanted to add something. As I was thinking it, Mahi put it in the chat box. Having a dedicated queer support system within the anti-ragging committee, which is separate from the other issues, will be extremely helpful, but also extremely isolating. If the person is going to the particular LGBTQ support place, or even again, the members of that committee should be well equipped and well educated and sensitized regarding how to communicate and how the language they use, everything matters. What I think is each college has to form an anti-ragging committee. It will have a set of rules, a set of information regarding how to select or what all the anti-ragging committee will do if this happens. There should be a protocol. Just like that, we can make a actual protocol to our college, like submit it to our college, and put this step ahead so that they actually see it as a problem. Homophobia and like bullying is very very harmful to all students, and as of now it is a little normalized, like calling someone gay, or like even like it is extremely normalized, which is extremely messed up too. But once we start talking about it and actually doing actionable steps, like going to the management, submitting our views, and actually getting it up there, we can do changes within our colleges. As Shreya said, one person at a time, one step at a time, we need to move ahead. That's what I wanted to add.
Definitely.
Hello.
Nanya, the floor is
Can
yours. Oh, hi. Let me just.
Hi.
Hey, can you just
I
turn on
just
your
have
video, please?
uh, can I be seen?
Yes,
Okay.
you are.
Hi everyone. My name is Shasha. My pronouns are she and her, and I identify as a demisexual. So yeah. The thing is, as Rakshita said, if there is a separate community for the LGBTQ, my views on it are that pretend we have three people working on the LGBTQ thing. So now, if I, as a demisexual or someone who's still in a questioning phase, anyone goes to that particular person or approaches them, and if there's anyone who sees them, I feel like they'll be shunned even more as compared to a person who would just go to a normal anti-ragging community. And I feel like, in a way, yes, it will help, the person, because you can be more comfortable with the the person will be more equipped and they'll know more and they'll be able to help better. But at the same time, in a situation that we are in, I think it's not the best idea, because a person can clearly be like even if a person is just questioning, they can be like, oh my god, what if they want to like change their identity completely. And we all know how people talk, and it's obviously going to be blown up into a major thing, even if it's just like a person just trying to figure their way out about their gender and about their sexuality. And it's just going to make things worse as of now. So it shouldn't be the first line of event that we should like it shouldn't be the first thing that we should do. Maybe in a way later when it's established, then to help them. Yeah, I think the best thing would be to source out the anti. If a person approaches the anti-ragging community and the anti-ragging community knows that this person needs a specific person to help them, needs someone from the community to help them, then they can refer them to the person from the community instead of them directly approaching the community, because I feel like that is a safer and a more confidential way, and it prevents the person from being shunned or being ridiculed for it. So the idea is good, but the implementation could be so.
First of all, I would like to thank you for recognizing that this is a safe space and coming out to us. Can
Thank you
everybody
so much.
please give a clap of hands for Trisha?
Thank you.
Thank you so much. Um, I would like to ask you one question first before we get into a good discussion with you. Do you feel like all the points that we've spoken so far are inclusive and helpful?
My views on it, see, the thing is, I do have a few friends who are bisexual, a few friends who are lesbians, but then I cannot. Demisexual is a very separate topic when it comes to the general LGBTQ identities, and
Definitely.
it's not really, as much as I belong to the community, I cannot identify myself with them, because they really have a lot of issues. Like, I do not have, as you said, a heterosexual cis gendered person and a demisexual person may be almost the same. It's just about our emotional connections and it's about our sexual encounters, but it's really not anything about how, like the other problems that a person who's bi or who's lesbian or gay or transgender may face. So I really don't think I am in the right position to actually speak for them as much as I belong to the community, because I feel like I wouldn't do it justice, honestly. But by far, whatever's been talked about, I think those are really good ideas, and I think that they would like them. As I wish I could say something, but I really cannot, because they all have their own issues and their own problems.
Definitely. Thank you so much for highlighting that thing as well. While we do speak about the community, everyone just assumes that everyone in the community has similar issues and similar opinions. But it's actually what I personally believe is the community is fighting for inclusiveness in all forms. It's asking you to I accept and identify that love is just love, and who you are is who you are. You don't really need to be judged based on your gender or your sexuality. I mean, it's the personality that matters, right? Like, it's your morals and your principles, which does not change whether you decide to love somebody or you decide that you don't, you're you're cisgender or transgender or anywhere in between in the spectrum. Am I right about this?
Yeah, you're absolutely right. I think, firstly, people hardly know a lot about LGBTQ community itself. Like, people think it's just, lesbians and transgenders and bisexual people and gay people. Like, that's all they know. And I'm not saying just about, I'm talking about our generation itself. I think they themselves do not know what other sexualities are, and and every sexual, there's a wide range of spectrum, and there's wide range of people who identify as completely different things. Like, a demisexual can also identify as a lesbian, and
Yeah.
they can have two identities. So people don't realize that. People have no idea about how it works, and I think there's just lack of awareness when it comes to it. Honestly, I don't think I would have found out that there's something called demisexual unless I came across it, unless I researched about it. And now that I'm talking about it and stuff, it's like I know that many people have never heard of something like this, and it's a very new concept to them. So as much as we talk about the four particular genders, like the sexualities, it's not just them, it's so many other people going through such different problems. It's a wide area. And I think as much as we are really focusing on those particular four gender sexualities that we talk about, it is still not inclusive of everyone else. And there's also the point that maybe the other people do not face as many problems, and these four sexualities do face a lot of issues, especially when it comes to people that are transgender. They have I would say they have a lot of issues that they face as compared to a person who just identifies as bi, because the shunning and the ridiculement of these particular people when they go out in society, when they ask for help, when they approach a person, is way more than a person just saying, "Oh, I'm into guys and girls." So it's a different problem when it comes to each sexuality, and that needs to be identified. And as general population, it's going to take a lot of time to educate people, to raise awareness about it, and to get them to talk about it. But that I think raising awareness should be secondary, and reaching out to these people and helping them should be primary, because as long as these people are safe, then we can worry about how we can, teach other people about it and stuff. Because if you're just focusing on teaching other people, but then at the same time these people are not getting the adequate help that they need, then what is the point of this whole conversation sort of thing?
Those are some very beautiful points. And I think everybody appreciates the insights that you're giving, and I see a lot of happy faces going. So that's nice that everybody's concurring with you as well. Just one last question before we wrap up. Do you believe that the safe space guidelines and norms that we shared on the group were actually inclusive and could be a step that could be implemented in the anti-ragging committees? And is there any corrections that you would suggest or anything at all? What were your thoughts on it?
I believe the guidelines you sent in were very appropriate, uh, very inclusive at that too. Not only did they create this as a safe space, but it will all, and as and when these are included in all the anti-ragging committees across India, it will ensure that people are more empowered to come out, to speak, to behave, to think freely, and express themselves, so that there's no hindrance to their really coming together with the idea, becoming one with the idea, and there's no hindrance as such. So I believe that the guidelines were good, and I might suggest it to my college.
Oh, that's nice. Yay. We already have people talking to their colleges. Um,
I think making pronouns a daily thing is very necessary. Like the way you said that starting your introduction with pronouns is very important. It's not just because, see, most of us, yes, we do have the usual pronouns that one might use for us, but if a person who does not identify with that, if they are, separated and only they are asked to introduce themselves with their pronouns, then obviously it's like, oh, they are introducing themselves with their pronouns because they are different, and because it makes them feel more isolated. So I think the entire discussion of just talking about pronouns, like just putting that in our day-to-day habit, just talking about it and saying, oh, hi, nice to meet you, my pronouns are she and her, or whatever your pronouns are. I think that is it's a small step, it's a very basic thing, but I think that will help the other people who really need the whole pronoun system to not feel isolated, to not feel differentiated. So I think that is one of the most important safe space guidelines that I think we should implement.
I'm so glad to hear you say that. So perhaps the 16 of us here on call, we can decide from today onwards that when we introduce ourselves, we will introduce ourselves in the following manner: name plus these are my preferred pronouns. Can we, guys? Yay. Okay. So, with that, we shall come to the end of our 1 hour session. And I really hope you enjoyed it. I definitely did. And I'm feeling empowered as a cis heterogendered person. And I hope that with this conversation, I feel that we have contributed some kind of a difference to look into this even further. But before we end for today, could I request everyone to please turn on your camera so we can take a picture together? Waiting for a few more cameras, so sorry about my network. Shrisha, Nitish, Salil, you may please stop screening and screen sharing. Mahi, uh, can someone please click the picture? Nitish, Salil, Mithun. Perhaps we can do little hearts. Oh, Vidipta is driving in with us. Wow, thank you for joining in. Little hearts, everyone. Okay, who's clicking the photo? Oh god, this is embarrassing. Mahi, can you do it? Alright, just one more, guys. Thank you so much for joining in. We will share the photos with you and let's continue this discussion on the group. And we hope you had a great time. I'll be ending the meeting for all now. Bye, guys.
It was like really amazing.